Health Director Stephanie Hayden Howard will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, followed by Janet Pichette, Austin Public Health Chief Epidemiologist. We will then open it up to the pool reporter who will ask questions on behalf of the media. Stephanie, over to you.
Good morning. Today, we celebrate our first year anniversary that we opened the department's operations center. As we think about 1 year anniversary celebrations, it is always a bittersweet anniversary for us. There are things to celebrate that we have established and really solidified our relationships across the city and with partners that don't work for the city of Austin, but have their roles here in Austin and Travis County. We must acknowledge the Austin Public Health staff, the staff that began this process a year ago, began monitoring and working with the Department of State Health Services as well as the Centers for Disease Control. It is bittersweet because most of us have folks that we personally know who have suffered from COVID-19, and we have folks that have died because of complications. The vaccine is here, and we are very excited about the vaccine, but we know it is in limited supply. So we are really calling for everyone to really think about, as you think about this weekend and thinking about Super Bowl weekend, our hope is that you stay home, you don't have parties with people that don't live in your home, and you continue to do the things that we have asked you to do. You all have worked with us so hard, and I know everyone has had to make sacrifices, but we have to be at a point where we all stay the course. We must continue to wear our mask, watch our distance, wash our hands, and if we're not feeling well, please stay home and make sure that you take a COVID test. At this time, I will transition over to Dr. Escott. Thank you.
Thank you, Stephanie. I want to reiterate the thanks to our staff and to all our partner agencies who've been along with us for this 1 year COVID-19 response. It has been a difficult year for all of us, but our team has done a fantastic job at navigating this response, and our partners have done a fantastic job as well. That all government, all community spirit in Central Texas and Austin and Travis County has led us to be successful in this response. We have to continue that process. We have to continue to work together over the next 6 months or so that we can get past and move back to more normalcy for our community. But I want to be very clear about something. The weekly allocations that we receive for vaccine are small. It's 12,000 a week. This week, we had more than 150,000 individuals who currently qualify as 1B on the list with Austin Public Health to receive the vaccine. 550,000 people are on the list to receive the vaccine total. The point I'm trying to make here is that we have a limited supply, and the vast majority of people who are waiting for a vaccine are going to have to wait for weeks or months to get that. But we have to recognize as a community that right now there are some people who need the vaccine more than others do. They need the vaccine because they're at higher risk for contracting the disease. They need the vaccine now because they're at higher risk for severe disease and for death from COVID-19. So if your neighbor is able to get a shot and you are not, that is good for this community. We hope that we can provide all people with a vaccine, either through Austin Public Health or one of our partners, in the coming months, but it is going to take us a while. So we ask for your patience. We ask you to continue to do those things which we know can protect you. The vaccine is one option. It's a great option for protection. But these masks, the distancing, the hand hygiene also work very well. We need people to stay the course. We need people to continue the vigilance to get us out of the current surge and ensure that we can decrease the deaths, decrease the hospitalizations, and ultimately save many lives. With that, I'll pass it over to Janet Pichette.
Good morning, everyone. I do want to remind people that as of today, or as of Wednesday, the Austin Public Health has received its first confirmed case of the UK variant within Travis County. And I just want people to be mindful that we anticipated that this would happen as far as various variants circulating in our community, but it does serve as a reminder that we do need to continue with those non-pharmaceutical interventions that are life-saving in protecting us and from disease transmission risks, and that is making sure we wear our masks, making sure we wash our hands and avoid touching our face, making sure that we socially distance from others, and if you're ill, you need to stay home. Again, we are optimistic and hopeful that we do have vaccine on our horizon. And as the weeks progress and we progress through these very frustrating times, we will continue to have additional vaccine rollouts. I'm very optimistic that Johnson & Johnson has applied for emergency use authorization for their new vaccine, which will provide some additional vaccine resources to our community. So until we are able to get to the point where we have plenty of vaccine in our community, we need to continue with these non-pharmaceutical interventions that we have been discussing over the year to make sure we protect and reduce transmission risk. As we enter this weekend for Super Bowl Sunday, as both Director Hayden Howard and Dr. Escott have mentioned, we need to make sure, we know these social gatherings are prime events for disease transmission to occur, and it's all the more important that if you celebrate, you make sure that you do those activities and distance and mask. We encourage you actually not to celebrate in a group gathering. Our case counts continue to remain at a very high level. While they may be flattening out and we do see reductions in hospitalizations, we still continue to see high numbers of cases coming in on average every day. And with that, I'll go ahead and turn it over to our media facilitator.
Thank you. At this time, we will open it up to our pool reporter, Sangeeta Mignon from KUT. Sangeeta?
Our first question is from KUT. APH said vaccine appointments are now being released Tuesdays and Thursdays. What time are they released those days? It's our understanding that on those days, APH is sending emails to some eligible individuals in advance to let them know appointments will soon open. When should these individuals know to check their emails those days?
Yes, that is correct. We will be releasing appointments on Tuesday and Thursday. The times will vary. In addition to the Tuesday, Thursday release, our goal is because we want to make sure that individuals that may have registered when the system was first operating, we are reaching out to them proactively. In addition to that, we're also reaching out to individuals that are 80 years of age and older. And so our goal is that we definitely want to make sure that we offer them the opportunity. And so typically it would happen the day before. They would see an email the day before that signifies that we would want them to log in on Tuesday or Thursday.
The next question is from KXAN. Will you be recommending City of Austin code enforcement increase their patrol this weekend to monitor restaurants and bars ahead of Super Bowl Sunday? If not, what extra steps is the city taking to ensure public safety this weekend?
The enforcement team is not only code enforcement, it is a team of city as well as county enforcement personnel. It is environmental health services staff, as well as APD and the fire marshal. And so they typically, as we are, they have a calendar of events where they are able to increase their enforcement efforts. And so this weekend, that will be the same. They will continue those enforcement efforts this weekend.
I'll add on to that. It's important for us to remember that, as we've been saying for the past year, we can't enforce our way out of COVID-19. We do really need folks to heed the warnings, heed the advice, follow the recommendations, and make decisions which are going to protect themselves, their families, and their community. We have seen a lot of household spread from individuals who perhaps were not careful, were involved in social gatherings, and they bring it home to their family. Sometimes it's siblings, sometimes it's parents, sometimes it's grandparents. And it can have a devastating effect. So ultimately, we need folks to continue to make the decision to stay home, to only go out if they have to, and to celebrate Super Bowl at home with their own family who live in their household.
The next question is from the Austin American Statesman. Some Travis County residents in the B1 group on Thursday received emails from Austin Public Health letting them know of available vaccines, but experienced several glitches while trying to pick a date and time before another error message appeared that doses were all taken. How does Austin Public Health plan to fix these website issues in the short term to ease frustrations with the system? When can residents expect the changes?
So our IT team is working around the clock to address some of these glitches. We're aware of them. We've got a team working on it. We've got external consultants helping resolve some of these issues. We want to build the functionality, make it better and more user-friendly. Ultimately, the challenge we have is that there's not enough vaccine, that we're struggling with 12,000 doses a week for a city of 1.2 million, 1.3 million people. So our hope is that at some stage we can transition to, like we do for testing. And you register, and as soon as you register, you get a spot and you book it. We're months away from that. And ultimately, until we can get to that stage where folks can easily register and schedule for a vaccine, we're going to continue to struggle with these IT challenges. But our team is working hard and feel confident that as the weeks continue on, that interface between Austin Public Health and the public for vaccination will continue to improve.
And I'll just add that the IT group is definitely taking feedback that we have received from the community about issues and continue to troubleshoot those things. We're equally as frustrated on our end. We want to make sure that people are getting vaccine, and it is very difficult to know that people are having such difficulties getting in and pre-registering into our system. As Dr. Escott said, we have over 500,000 pre-registered folks that are signed up for receiving a vaccine in our system, and we're relying on the supply that's available to us. We know, and we've experienced this even during H1N1. It's a simple economic lesson in supply and demand that we had a lot of people who were very anxious to get the vaccine and continue to be anxious to get the vaccine, and we're just trying to address and make sure that we can meet the need. But at some point, more vaccine, as it becomes available, will begin to be allocated to our community partners, which will help alleviate some of this demand that we currently have. So we ask for patience and continued patience from the community. We know this is a difficult time, and we will try to troubleshoot any issues that we come across as quickly as possible.
The next question is from KOOP Radio. The Texas Data Quality Coalition suggests that capturing demographic data is necessary for serving our community's health needs that have otherwise been masked or erased away. What is the data showing about APH's vaccination of local communities of color who are suffering the consequences of community spread more than white neighbors?
We have provided the initial data about 2 or 3 weeks ago to our elected officials and made that information public. What we also know is that there have to be intentional strategies to be able to reach folks that have been disproportionately represented in the data. And so with the combination of the strategies of the outreach folks that are working for us, that have a mini grant, as well as our other established partners, those strategies are going to make sure that we are meeting the demands of providing vaccines to communities of color.
Let me add on to that. You know, one of the things that we have to keep in mind in Travis County, in Texas, across the United States, is that the demographics for older individuals, 65 plus years old, look much different from the demographics for younger folks. So we've got to be very careful about interpreting the equity of allocation right now based on race and ethnicity, because right now the national priority is older individuals. I can tell you that in our community, in the state, across the country, that group is predominantly white, not Hispanic, not African American. The percentages of those other race and ethnicities are much smaller the older you get. This is due to some of the underlying social determinants of health that lead to a shorter life expectancy for our communities of color. It, I think, again, provides a reminder to all of us that life expectancy is not equal in this country. It reminds us that we have to continue to focus efforts on strengthening the availability of access to health care and the other resources that are necessary to maintain one's health and increase the life expectancy for our communities of color. But, you know, I think that as we gather more demographic information, both locally and across the state and country, we do need to pay close attention to how that vaccine is being allocated, particularly once we get beyond that 65 plus age group, to ensure that we are able to reach the communities that have been impacted. APH is working hard. The city and county are working hard on strategies to ensure that we are able to effectively reach those communities, and we'll continue to do so throughout this vaccine rollout.
The next question is from Community Impact. Is Austin Public Health's new phone bank up and running yet? Will you release data about how many people have been reached through that resource?
The partnership that we have established with Travis County will begin those efforts starting on Monday of next week. We also are looking at this for more of a comprehensive call center model where we have the Travis County partnership, our existing nurse line, our connectivity to 311, as well as our equity team that are providing outbound calls as well. And so we are looking at this through a comprehensive call center site. And so that will be operating as of Monday.
The next question is from KVUE. If the Johnson & Johnson vaccine receives emergency authorization, how could that impact vaccine distribution in Texas?
Well, I'm happy to take that one. We're all anxiously awaiting that hearing on February 26th, where the FDA will consider the application. We're anxious to see the detailed data associated with that submission. But ultimately, this can have a profound impact on our ability to vaccinate people for a couple of reasons. Number one, it has the potential of increasing the availability of vaccines substantially. The indications that we have is that probably the initial allocations will be on the small side, but that Johnson & Johnson has the ability to rapidly expand that. The other big factor that we have here is that it's a single dose. A one shot and you're done. And that certainly makes the logistics of delivering vaccine much easier. It makes it much easier for it to be distributed to the 350 providers that have signed up to provide vaccines in the county. It makes it easier to have vaccination sites at churches and schools and other places because it only requires refrigeration. So it is going to be a game changer if it is approved, and certainly we are excited about it. I know there's some concerns that have been expressed about the efficacy. 66% for the overall population tested, 72% for the arm that was studied in the United States. But ultimately, we have to understand that the total protection is not the only part of the story and may not be the most important part of the story. The fact is that the data we've received so far is that it's 85% effective at preventing severe disease at 28 days. And at 49 days, it's 100% protective against that severe disease. So it is a very effective vaccine. It takes a little bit longer than the other two to achieve that high level of efficacy, but it does come. And certainly, because it's a single shot, it certainly allows us to, would allow us to provide a much larger and quicker ability to vaccinate the public.
The next question is from Univision. Do you have an update on the Johnson & Johnson vaccine and its availability for children ages 11 to 18?
Again, we'll have to all be watching the February 26th hearing to determine what the FDA says. We are still waiting on receiving the data submitted to the FDA that's going to be considered, and our hope is that it will add the ability to vaccinate much larger numbers of people in a shorter period of time. So again, we'll all be waiting on the 26th.
The next question is from the Austin Chronicle. In Austin Public Health's joint briefing to the city and county earlier this week, Director Hayden Howard said that the demographics info for the first week of APH vaccine distribution would be available by this Saturday. Is that still on track, and where will it be published?
The goal is to deploy our dashboard on our COVID-19 site with the rest of the dashboards. Just, letting folks know that this is an initial starting place for us, and it will only be Austin Public Health's data. And so the goal is to have that platform up and running tomorrow night.
The next question is from KUT. Your website says we are still working with Texas DSHS to understand their process for distributing the second doses of the vaccine. Is that still true, or do you now have a better understanding of the process? Do you have concerns that you'll have to use first dose allocations as second dose ones?
I'm happy to take that one. It's 10:56 right now on Friday. We don't have specifics regarding our allocation for Monday. We certainly anticipate continuing to receive an allocation of 12,000, but it's not clear to us yet if we're going to receive 12,000 first doses and 12,000 second doses, or just 12,000 doses for second doses. We have ordered them, both second doses and first doses, and we're hopeful that in the future DSHS will be in a position to provide more advanced notice regarding shipments, as well as multi-week allocations, so that we can start to schedule folks 2 or 3 weeks out. Part of the frustration that our community is feeling is they don't know when they're going to be able to get a shot. So having even 2 or 3 weeks advance notice where we can schedule people 2 or 3 weeks at a time will start to let people know, can I get one in the next 3 weeks or not? If I can't, okay, I understand that the supply is limited. But part of the challenge that I think our community is facing right now is there's constant frustration because there's too many unknowns. I know DSHS is working hard to streamline the logistics, to get us allocations. Part of that is based upon some uncertainty regarding how much supply is coming to the state each week. But again, we're hopeful that the Biden administration, the manufacturers are going to be able to provide us that advance notice so that we can start to schedule things out in the future. I will say that first doses will be used for first doses, second doses will be used for second doses. That is what's required of the state, and that's what we will follow.
And I'll just add that we have here at Austin Public Health submitted our paperwork to request second dose allocations of vaccines so that we can begin to roll that vaccine out to individuals who received their first dose through us. Again, we have not received notice that we have that second dose allocation coming to us yet, but as soon as we are aware of that allocation coming to us, we will begin the process of trying to schedule those second dose appointments out. And as Dr. Escott mentioned, I want, our first dose allocations can only be used for first doses. And so we cannot tap into the 12,000 doses that we typically receive each week for the use of second doses. So we made the request for that second dose allocation, and we continue to wait and stand ready to implement rolling out that vaccine once we receive it.
The next question is from KXAN. Austin Public Health released a flowchart to the public and media earlier this week, which was then widely distributed, which later had to be revised and corrected on 2 separate occasions. Do you think that is contributing to some of the confusion people are experiencing in the vaccine distribution process?
No, that is not adding to the level of confusion. I think that there is a shortage of vaccine, and because there is a shortage of vaccine, and I can't just call my pharmacy or my physician and receive that vaccine, then I am really bothered by that. And so as things change, we know that as things are implemented and things change, we have to make those changes. And so it's important for us that we typically will stamp a date at the bottom of any kind of publication we put out to the public, because we know it is subject to change. And we will also say that things are interim. because we know that as things change, we may need to reevaluate and change that document or guidance.
The next question is from the Austin American Statesman. Just to be clear, residents 80 and older will not receive an email 2 hours before vaccine appointments are going to be made available on Tuesdays and Thursdays, like Hayden Howard told commissioners on Tuesday. Hayden Howard said today that alerts would be sent the day before. Can we please have a detailed explanation of this process to avoid further confusion?
We are going to do a couple of things, because what we're finding is individuals that are 80 years of age and older, they typically are not checking their email on a regular basis. So when we are working with our Travis County call center, they are going to call them as well, because we have to have a process where individuals that might not be on email will have the ability to schedule an appointment. And what we have found is that most of our people that are elderly, even though we are sending them communication and sending it to them ahead of time, they are not checking those emails. And so the second step will be is that we will have a person that will be giving them a call. But I want to caution you all that there in our system, there are over 11,000 people that are 80 years of age and older. So all of them will not be called because we don't have enough vaccine. And so it will be a two-step process, allowing them some time to read the email, and then folks will give them a call. And they will be based upon when they registered in the system.
The next question is from KOOP Radio. Can any plan to inoculate all those in just Phase 1A and Phase 1B succeed, even over an extended period, without fully engaging the 350 plus APH commercial partners?
I think that, it's going to be very difficult for APH alone to vaccinate, the 150,000 that we have now in a timely fashion. I think traditionally we depend upon our partners in the community. When we look back at H1N1, the vast majority of vaccines for H1N1 was done by private partners, as compared to Austin Public Health. We expect that as vaccine supply increases, that more and more vaccine will be distributed to those other partners, those 350 other partners, to HEB, to CVS, Walgreens, Austin Regional Clinic, Baylor Scott and White, Ascension Seton, and others, to help in this process. The challenge that we have right now is there's a very limited supply and a very focused group of people who qualify for it now, who we want it to get to right now. And that means that a focused effort that's efficient is of benefit at this stage. And that's, the mass vaccination sites that we see now. I expect that as we enter into mid-spring to late spring and the vaccine supply increases significantly, that we'll start to see more decentralization of the vaccination effort and see it more commonly in those pharmacies, doctors' offices, and other clinical settings where people may traditionally get their vaccines for things like flu.
This is the last question coming from KVUE. In San Antonio, Meals on Wheels is helping the city identify elderly people stuck at home who need the vaccine. Is APH working with any organizations like Meals on Wheels, Central Texas, or any other group to help identify any of the older homebound people that need shots?
Austin Public Health is working with several nonprofit partners in order to identify individuals that will need that mobile service to be provided that vaccine. one of the other things that is also a strategy is that we are definitely, because we know that there's some folks that may not be working with a nonprofit organization. And so we are going to use our marketing and media to be able to get the word out, to let individuals know that this is a process that we have similar to what we did for testing. So what we'll do is we'll put that word out using our media outlets, and then as a result of that, in between our partners, our goal will be able to provide those vaccines.
Thank you, Stephanie. At this time, we will go into our closing remarks. Director Hayden.
As we stated earlier, we just want everyone to have patience with us as we are providing the vaccine in the community. As we move through this weekend, knowing that it is Super Bowl weekend, our hope is that you will not attend parties, you will not host a party, that you will have a viewing party at your home with the people that you live with, because our goal is that we must stay the course. And so, as we said, we're excited about the vaccine, but it is very limited. And so even when people have the vaccine, it's important to know that you still must continue to wear your mask, watch your distance, and wash your hands often. And so please keep those things in mind. Please continue to be a strong partner of public health to keep us all healthy and safe. I'll transition over to Dr. Escott.
Once again, it's important to be patient with the vaccine. Recognize that there are folks who need it more than others do at this stage, and to allow them to get the shot. Allow our elderly members of our community to get the shot. Allow folks who have underlying health conditions to get the shot. There's a lot of gamesmanship going on right now with vaccine administration around the country. Where folks are being dishonest. They're putting themselves ahead in line when other folks need it. And it's important that as a community, we recognize that we are not always first, that sometimes other people need to be in front of us. So we're asking people for patience. We're asking people to ensure they're reaching out to their loved ones who may be older, who may have underlying health conditions. Ensure they've signed up for vaccination. If they're not computer savvy, help them out. Get them signed up. Ensure they're in line. Again, we have more work to do. While our numbers are falling, our hospitalizations, our case numbers are falling. We are still around where we were in the peak this summer. So we've got a long way to go still. We'll put ourselves in a better place to protect this community and allow us more opportunity to get folks vaccinated. So please continue to do your part and stay home and stay safe.
And I'll just add that, again, we do have our cases counts falling. I just want to remind people, we still, as Dr. Escott mentioned, our case counts still are at the level that we saw at the peak in July, on average 600 new cases a day. So we need to be ever more vigilant. We need to continue to be vigilant about reducing our disease transmission risks. We have new strains circulating in our community, as evidenced by a new case confirmation on Wednesday of the UK variant in Travis County. We anticipated we would see these. I imagine over the course of the next few weeks, we will continue to see additional cases pop up as serological testing continues or genome sequencing continues. So, it just is a reminder that we do need to continue to be vigilant and practice our prevention measures that we've been discussing over the course of the last year, and that's to make sure you wear your mask, you socially distant, you avoid confined spaces, avoid touching your hands and face, making sure you're washing your hands frequently, and staying home if you're ill. These are things that we know work in preventing disease transmission risks. And if you do celebrate Super Bowl, we, as both Director Haydenhauer and Dr. Escott have mentioned, do it in the safest manner possible, and that would be to watch the game at home with your families in your household and avoid larger social gatherings, which are very common for spreading disease rapidly through the community. Thanks, and have a great Friday.
Thank you. That concludes our media availability for today. Thanks to APH Director Stephanie Hayden-Howard, Dr. Mark Escott, and Chief Epidemiologist Janet Pichette, along with our pool reporter, Sangeeta Mignon from KUT. Thanks for joining us, and have a safe day.